Psoriasis is often described as a skin condition, but for millions of people around the world, it is far more than that. Psoriasis is chronic. It does not simply disappear. It can last for years, sometimes for a lifetime. And while the symptoms appear on the skin, the impact often reaches much deeper. Research consistently shows that people living with psoriasis experience significantly higher rates of anxiety and depression compared to the general population. Some studies suggest that up to 1 in 3 people with psoriasis will face a mental health condition during their lives. This is not a coincidence. Living with a visible condition can affect how a person sees themselves and how they believe others see them. Many people with psoriasis describe feeling watched, judged, misunderstood. They may hear questions they never asked for. They may notice looks that linger too long. Over time, these experiences can slowly erode confidence. Studies in dermatology and psychology show that psoriasis is linked to lower self-esteem, social withdrawal, sleep problems, and chronic stress. Some people begin to avoid social situations. They avoid swimming pools, short sleeves, public spaces, not because they want to hide, but because they want to protect themselves. There is also a powerful biological connection. Medical research has shown that stress and anxiety can worsen psoriasis symptoms, increasing inflammation and triggering flare-ups. This creates a difficult cycle. Stress worsens the skin worsens stress, and the cycle continues. For many, this cycle is exhausting. Quality of life studies have found that the emotional burden of psoriasis can be comparable to other serious long-term illnesses, affecting relationships, work life, and daily functioning. Yet despite this, people living with psoriasis are often told, "It's just skin. At least it's not life-threatening." Others have it worse. But pain is not measured only in survival. Emotional suffering is still suffering. Mental health research shows that when people feel dismissed or unheard, symptoms of anxiety and depression often worsen. Many people living with psoriasis describe a sense of invisibility. Their condition is visible, but their emotional experience is not. This is why platforms like Digital Hope exist, to create space for understanding, compassion, and shared stories. Through community voices and awareness content on digitalhope.uk, people are reminded that their experiences are real, valid, and shared by others. Some struggle silently. Some feel ashamed to speak. Some believe they must be strong all the time. But strength does not mean silence. True healing begins when experiences are acknowledged, when people are believed, when they are supported without judgment. This is why awareness matters. Psoriasis care is not only about managing physical symptoms. Research increasingly highlights the importance of mental well-being, emotional support, and community connection. When people feel understood, they cope better. They feel less alone. They regain confidence. Digital Hope was created to support that journey, to give voice to stories that are often left unheard, to build a community rooted in empathy and hope, available to anyone who needs it at digitalhope.uk. Hope does not mean pretending everything is fine. Hope means knowing you are not facing this alone. It means finding strength in compassion, in shared humanity, in connection. Psoriasis is more than skin, and behind every flare-up, there is a human being deserving of dignity, empathy, and care. This is Digital Hope, and this story is for everyone who has ever felt unseen and is still choosing to keep going. Don't forget to visit our website, digitalhope.uk.